So with that, let's start with the back of the wrist, or the dorsal side. And what we're going to do is we're going to go through the 6 compartments, and I'll also talk about the scapholunate ligament, which is one of those acute injury issues that that you might want to look for. I'm going to try to keep this practical and keep it pertinent to the relative pathology that you might see, rather than just doing a screening of everything, because I'd rather at least the more common diagnoses than some of the esoterica. So let's start with the compartments. So there's 6 dorsal compartments. 1, 2, 3, 4, 5, 6. There are 9 nerves in those compartments. Okay, and a way to memorize the number of, not nerves, tendons. There are 9 tendons in the dorsal compartments. The way to remember those tendons and how many are in each is 2, 2, 1, 2, 1, 1. All right. There's 2 tendons in the first compartment, 2 in the second, 1 in the third, there's 2 groups of tendons in the fourth compartment. We'll talk about the fifth compartment only has 1, and the sixth compartment has 1. 2, 2, 1, 2, 1, 1. And the other mnemonic, which may be helpful for you, the first 5 tendons goes, if you remember, long, short, long, short, long. And that is the orientation going from the radial side of the wrist across the back of the wrist. So the idea is the names of the tendons may be sometimes challenging. The first compartment is composed of the abductor pollicis longus and extensor pollicis brevis. A saying you can use that sometimes people use is, all peanut lovers eat peanut butter. That's the first compartment. There's 2 tendons in that. The first compartment is notorious for de Quervain's tenosynovitis, which is going to be a little bit of irritation of the tendons from repetitive use, perhaps a drummer or people that are toggling their thumb quite a bit. And you can use the Finkelstein test, et cetera, clinically to identify that as a presupposition diagnosis, and you can confirm it with the ultrasound. And the first compartment is also associated with the intersection syndrome, which is where the first compartment tendons will glide over the second compartment tendons as they approach the radial wrist. And we'll look at that here in a second with the ultrasound, once I dig into the ultrasound scanning. The second compartment is really the extensor carpi radialis tendons, the 2 of them. There's a long and a short. They don't usually cause much problem, but they can be associated with distal intersection syndrome, which is where the extensor pollicis longus tendon, which is coming from the compartment 3, crosses over the extensor wrist tendons distal to the wrist as it's going over towards the thumb. The people who might get those are typically rowers, weightlifters, things like that. So that would be a clinical supposition. It's not very common, but it's something that you can look for. Compartment 3 is the extensor pollicis longus tendon. That one is very prone to injury because it wraps around Lister's tubercle and can get irritated by that. It can also, with rheumatoid arthritis, can be affected and can easily rupture. Again, you would see it's the extensor pollicis longus, so the distal phalanx of the thumb would not be extending, and you would lose the tendons of your snuff box. There's the 2 snuff box tendons are the thumb tendons, the extensor pollicis longus and the extensor pollicis brevis. And just deep to that snuff box is the scaphoid. So as far as surface anatomy, you should be able to see those tendons in a non-swollen or non-puffy hand, and that'll help you define kind of what you're looking at. Compartment 4 are really all the finger extensors, and those are both the extensor indicis proprius is a separate tendon, and then the extensor digitorum tendons. Extensor 5 is extensor digiti minimi, that just lifts up your pinky. Also sometimes affected with rheumatoid arthritis, something called Vaughan Jackson syndrome. But with chronic RA, you can sometimes get tearing or disruption of that extensor digiti minimi tendon. And then the compartment 6 is the extensor carpi ulnaris. And that one has also association with rheumatoid arthritis. It can also be irritated by people who are constantly pronating and supinating their wrist, because this tendon can slip off the ulnar styloid. It can slip off the groove and cause some irritation. So let's get into it now and see what just now. That's the kind of the gross anatomy, the fine anatomy. Now we're going to go into the ultrafine anatomy.